Hi guys, this is Jessica Vida and this is my presentation for Social Work 527 Field Seminar. I am actually doing my presentation on my current employer and it is also where I'm doing my field practicum. It is through Thrive Wellness and Recovery. So a little bit of the background history of Thrive. We were actually established in 2024. It came about through a merger with another local agency, Transitional Living Services, and it was driven by the need to provide both substance use and mental health services to those in need in our local community. Actually, our agency was founded in 1973 and was originally called Credo Community Center for the Treatment of Addictions. And it was founded by a local priest as a mother in his congregation came to him requesting help for her son who was struggling with addiction. The very first facility was located in Evans Mills, New York, and it was actually a co-ed facility. That facility and structure is still standing, and it is utilized as our intensive residential program for male youth. The agency has since evolved. We have 2 outpatient clinics, 2 reintegration residential programs for men, and a women's 820 reintegration residential program as well. The mission and vision of the agency is transforming lives through person-centered services that promote wellness and recovery, and the vision is a thriving community of healthy individuals. Populations served and contributions. Thrive is a nonprofit agency that serves all individuals with mental health and substance use disorders in Jefferson and Lewis County. We include children, adults, couples, families, and they aim to provide high quality services to those struggling with mental health and substance use disorders. They can provide both assessment and diagnosis for mental health and substance use disorders. They can make referrals to assess the needs for higher levels of care, and staff are trained to provide culturally competent services to all individuals within our local community. So what types of services does Thrive provide? So we, as of the past few months, just became a comprehensive certified community behavioral health clinic. So the basis of that is that we kind of have to provide these core services, which include 24/7 crisis management. We actually partner with the agency we merged with, TLS, and the Children's Home of Jefferson County. There is an on-call crisis management specialist from one of those agencies, and there is a 24-hour hotline that individuals can call to receive help and services. And that individual will kind of talk through or try to, de-escalate the client. But if medical emergency services are needed, they would then call their partner who is also on call, and they would call local law enforcement and meet that client within the community. We also provide screening, assessment, and diagnosis, person and family-centered services, outpatient mental health and substance use treatment, primary care services, peer services, care management services, and again, we also have the reintegration residential programs for men and women, the intensive residential program for our male youth, and supported living and apartment programs in the local community. We actually, like I said, just started this process fairly recently, so we're still kind of working out and managing some of the kinks and issues with that, but we also provide medication management services for those who have mental health, any primary care medications that we would need. And we also do have a dispensation clinic for MAT. Our Louville clinic does all of these same things and is also working to establish setting up their dispensation clinic as well. So the organizational flow chart, there's a lot of moving parts, especially since our agency just recently merged, but I kind of tried to break this down a little bit more for our outpatient services and kind of primarily incorporate kind of where the social workers fall in this. So we have our executive director, There's a director of outpatient services. There's also a director of like medication-based services at outpatient, but I just didn't include that in this chart. There are 4 senior therapists, and then the social workers and the social worker interns. And like I said, there are also several other various roles within the agency, and different directors who oversee specific programs like care management, peer services, like the medication management, the nurses, those things as well. The roles and responsibilities. So the executive director, he provides oversight over the entire agency and over each person within the organizational structure. The director of outpatient services provides oversight for all the services and staff at the outpatient clinic and ensures all operations are running effectively. So we do have one, obviously, for our main clinic in Watertown, and then there's also a director of outpatient services for our Lowville clinic. Senior therapists. There are 4 senior therapists, and they provide supervision to the social workers, and they also maintain a caseload and assist with implementing groups. The social workers provide individual, group, couple, and family sessions, and there are also social workers who are embedded into our local school systems, as well as probation, parole, and drug court. And then the interns assist with engaging clients through admission assessments. And typically they start off by observing groups and individual sessions, and then as they kind of build and gain experience, they're able to take on a small caseload and begin facilitating groups and individual sessions on their own. What does the agency do well? Thrive aims to provide high quality services to those struggling with mental health and substance use disorders. They aim to provide a safe, judgment-free space where clients feel comfortable. They provide person-centered care that is both empathetic and caring, and staff are trained to provide culturally competent services to all individuals within the community. They also provide those wraparound services, as clients are now able to receive all of those services, both mental health, substance use, and primary care, all in one place. Where can the agency improve? So I think I've talked about this a couple times in some of our personal reflection essays, but the interagency communication at times has been a little lacking, especially with all the changes as the agency has kind of moved to the new CCBHC model. So sometimes there are things that are coming out that aren't necessarily passed down the chain and can read and be a little bit confusing. Community collaboration. There are many opportunities for our agency to collaborate with other agencies within the community to better assist with things like housing, transportation, and voc ed needs. And many staff are not actually aware of all the different resources that are out there. I think that, again, this ties into the next part about training or in-service trainings. While we do have very specific trainings that we are mandated to complete each year, I feel that we would benefit from having other local agencies come in and kind of provide an overview of their services and work to see if maybe we can collaborate and just make it more known about what's available to us and our clients within the community to better assist them. So my role and what I hope to learn. As a social work intern, I've been able to engage with clients in individual sessions, actively facilitate groups. I have been working on specifically the Seeking Safety group, which is a trauma-based group for both men and women. Engage clients at admission and administer appropriate assessments. Collaborate with a multidisciplinary treatment team on cases weekly. We do this every Tuesday morning. Even if I am not necessarily on site at the agency, I do join by teams, and it's just an opportunity for all of the clinicians to bring up any cases that they might find to be difficult or they may want advice on. We collaborate with our NPs and a local psychiatrist who provides a group supervision and gives feedback to any difficult cases. I've also been engaging in weekly supervision to discuss cases or concerns, and I've just really had a great opportunity to sit with several of the different clinicians at Thrive and get to see their different and varying approaches to treatment. So it's been very helpful. I hope to learn to strengthen my skills in assessment and client engagement, to understand and apply various therapeutic techniques, to deepen my understanding of mental health and addiction and how this impacts our clients, not only on an individual level, but on a community level, and really work to advocate and assist them. And just to build my overall confidence as I continue to learn and grow as a clinician. I worked with the agency now for about 7 years, and I have held various roles. I started on as a case manager at our outpatient clinic, and I really worked to assist clients with, finding safe and stable housing and setting up transportation and getting to appointments. So I had an opportunity to kind of learn, the various resources and things like that within our community. And then I ended up moving to one of our men's reintegration residential programs as the primary counselor, and was able to do that for a few years. Within the houses, they focus primarily on the substance use side of things, as typically the counselors in the house are CASACs, and then they come over to outpatient to do the mental health portion of things. And from there, I became the clinical supervisor of one of our men's houses, and was overseeing any of the clinicians in the house, and it kind of helped me gain my supervisory experience. And currently, I am the program director of one of our men's reintegration residential programs. So it's a company that really provides you the opportunity to learn and grow. And I think that for me, obtaining my master's in social work is just sort of that next step for me to make that next move, and grow and end up moving over to outpatient as a full-time therapist once I complete. So that is my presentation on my agency, and I look forward to, seeing and listening to all of yours. Thank you.